Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about emphysema. In particular, I will cover what is emphysema, how do you treat emphysema, and how you can live more successfully with emphysema. So we start with what it is. Emphysema is a factor in the progression of chronic obstructive pulmonary disease, or COPD. It's a condition that limits the flow of air when you breathe out. Emphysema occurs when the air sacs at the end of your smallest air passage, the bronchioles, are gradually destroyed, and smoking is the leading cause of emphysema. As it worsens, emphysema turns the spherical air sacs, clustered like bunches of grapes, into large irregular pockets with gaping holes in their inner walls. So this obviously reduces the number of air sacs and keeps some of the oxygen entering your lungs from reaching your bloodstream. In addition, the elastic fibres that hold open the small airways leading to the air sacs are slowly destroyed so that they collapse when you breathe out, not letting the air in your lungs escape. So airway obstruction, another feature of COPD, contributes to emphysema. The combination of emphysema and obstructed airways makes breathing increasingly difficult. Treatment often slows but doesn't reverse the process. So the symptoms of emphysema. So emphysema symptoms are mild to begin with but steadily get worse as the disease progresses. The main emphysema symptoms are shortness of breath, wheezing, chest tightness, reduced capacity for physical activity, chronic coughing, which could also indicate chronic bronchitis, loss of appetite and weight, and fatigue. The causes of emphysema include smoking. So cigarette smoking is by far the most common cause of emphysema. There are more than 4,000 chemicals in tobacco smoke, including secondhand smoke. These chemical irritants slowly destroy the small peripheral airways, the elastic air sacs, and the supporting elastic fibres. Protein deficiency. Approximately 1 to 2% of people with emphysema have an inherited deficiency of a protein called AA1, which protects the elastic structures in the lungs. Without this protein, enzymes can cause progressive lung damage, eventually resulting in emphysema. If you're a smoker with a lack of AA1, emphysema can begin in your 30s and 40s. So the risk factors for emphysema include obviously smoking cigarettes. Emphysema is most likely to develop in cigarette smokers, but cigar and pipe smokers also are susceptible. And the risk for all types of smokers increases with the number of years and amount of tobacco smoked. So age is another risk factor. Although the lung damage that occurs in emphysema develops gradually, most people with tobacco-related emphysema begin to experience symptoms of the disease between the ages of 40 and 60. Exposure to secondhand smoke would be another factor. Secondhand smoke, also known as passive or environmental tobacco smoke, is smoke that you inadvertently inhale from someone else's cigarette, pipe or cigar. And occupational exposure to fumes or dust. So if you breathe fumes from certain chemicals or dust from grain, cotton, wood or mining products, you're more likely to develop emphysema. Exposure to indoor and outdoor pollution. So breathing indoor pollutants such as fumes from heating fuel, as well as outdoor pollutants like car exhaust, for instance, increases your risk of emphysema. So next is, how do you treat emphysema? The medications to treat nicotine addiction, such as nicotine gum or patches, and the prescription medicines, Zyban and Champix, is the number one line to treat and manage nicotine addiction first. Other emphysema treatments focus on helping you feel better, stay more active, and slow the progression of emphysema. And they include bronchodilators, so these drugs can help relieve coughing, shortness of breath, and trouble breathing by relaxing constricted airways. Inhaled steroids, so corticosteroid drugs inhaled as aerosol sprays, may relieve symptoms of emphysema. And gastroesophageal reflux disease aggravates airway disease in many people, so this needs to be managed. Supplemental oxygen. So if you have severe emphysema with low blood oxygen levels, using oxygen regularly at home and when you exercise may provide some relief. and pulmonary rehabilitation programs. A key part of treatment involves a pulmonary rehabilitation program, which combines education, exercise training, and behavioural intervention to help you stay active and improve your quality of life. Antibiotics. So if you have developed a bacterial infection like bronchitis or pneumonia, antibiotics are appropriate. Inoculations against influenza and pneumonia. So if you have emphysema or other forms of COPD, experts recommend an influenza or the flu shot annually and a pneumonia shot every 5 years. And surgery. In an experimental procedure called lung volume reduction surgery, surgeons remove small wedges of damaged lung tissue. Removing the diseased tissue helps the lungs work more efficiently and helps improve breathing. So how can you better live with emphysema? So if you have emphysema, you can take a number of steps to halt its progression and to protect yourself from complications. So obviously the first one is stop smoking. This is the most important measure you can take for your overall health and the only one that might halt the progression of emphysema. Avoid other respiratory irritants. So these include fumes from paint and automobile exhausts, some cooking odours, certain perfumes, even burning candles and incense. Exercise regularly. So try not to let your breathing problems keep you from getting regular exercise. And clear your airways. If you have chronic bronchitis, mucus tends to collect in your air passages and can be difficult to clear. To keep secretions thin and easy to bring up, drink plenty of non-alcoholic fluids every day. Protect yourself from cold air. So cold air can cause spasms of the bronchial passages, making it even more difficult to breathe. During cold weather, wear a soft scarf over your mouth and nose before going outside to warm the air entering your lungs. And avoid respiratory infections. So get pneumonia vaccinations as advised by your doctor and get the annual flu jab. Maintain good nutrition. A balanced diet gives your body the nutrients it needs for energy, for building and maintaining cells, and for regulating body processes. So work towards and maintaining a desirable body weight. So finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing emphysema more effectively. To start with, we have numerous products to get you started on a gentle exercise program, such as exercise balls, floor mats, weights, and various other items that you need to get started on a program that we will create together and is tailored specifically to you. You should speak with your GP or consultant to get the go-ahead before starting any exercise plan. We also have various supplements and products which you can purchase from us without a prescription, such as light boxes, blood pressure monitors, blood sugar monitors, and blood fat monitor, body fat monitors, and assisted living devices. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute telehealth clinic with us, and we help to increase your understanding of your illness. During a telehealth clinic, together, we create a cohesive management plan which enables you to take a more active role in managing emphysema with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.